social division, wealth gap, racial discrimination, and poor protection of the rights and interests of vulnerable groups. All of the country's deep-rooted problems have been exacerbated by U.S. administration's bungled response to the pandemic. It revealed Washington's hypocrisy and duplicity on human rights. Despite early warnings over the novel coronavirus, the United States soon became the world's hardest-hit country with the most confirmed cases and the highest death toll from the pandemic. According to the latest tally by Johns Hopkins University, the U.S. confirmed COVID-19 cases rose to over 4.4 million and more than 152,000 deaths as of Friday. And the death toll of the virus exceeded the sum of those who lost their lives in the Korean War, Vietnam War, war in Afghanistan, and Iraq War combined. The U.S. government's selfishness, short-sightedness, fickleness, incapacity, and irresponsibility have all been exposed in disappointing handling of the pandemic. Due to its flagrant disregard for early warnings over the pandemic, Washington missed the narrow window to nip the contagion in the bud. With the illness still uncontained, certain U.S. politicians disregarded professional warnings and rushed to loosen restrictive measures for economic gains, which only triggered a rebound of the outbreak. Greg Gonsalves, co-director of Global Health Justice Partnership at Yale University, said the Trump administration's COVID-19 response is getting awfully close to genocide by default. Unfortunately, the country's vulnerable groups, including the elderly, the poor, African Americans, and Latino Americans, have borne the brunt of COVID-19 and remain most at risk. According to the New York Times, in at least 23 U.S. states, a majority of deaths are linked to nursing homes. Not long before George Floyd was suffocated to death by a white police officer, he lost his job as a bouncer at a restaurant. His misfortunes not only result from America's entrenched, systemic racial discrimination, but also served as an epitome of the aggravated sufferings facing non-white Americans during COVID-19. Long-standing systemic health and social inequities have put racial and ethnic minority groups at higher risk of getting COVID-19 or losing their lives. Statistics show that non-Hispanic black persons have a rate of infection or death from the coronavirus approximately 5 times that of non-Hispanic white persons. According to Mark Morial, president of the National Urban League, the country's largest historic civil rights and urban advocacy organization, compared with white people, the U.S. medical and healthcare systems do not show justice to African Americans. The latter receive less treatment, and treatment for them is of lower quality. On the labor market front, the racial unemployment gap has been further widened during the pandemic. In June, America witnessed the widest gap between African Americans and whites in 5 years. According to data released by the Labor Department on July the 2nd, the jobless rate for the colored group plunged 15.4%, while the rate for whites dropped 10.1%. According to a recent report released by Center for Economic and Policy Research, after the pandemic broke out in some detention centers, the U.S. Immigration and Customs Enforcement, or ICE, without testing immigrants held there, still continued deporting them back to their home countries. The think tank found in late May that since March the 13th, ICE has made at least 135 deportation flights to 13 countries in Latin America and the Caribbean. Deportees have later tested positive in Guatemala, Jamaica, Mexico, Colombia, and Haiti. Besides exporting COVID-19, the common enemy of mankind, the United States has long shown indifference to the urgent need for unity and solidarity in the global anti-pandemic fight. It keeps pursuing unilateralism in the name of America First through a series of moves, including imposing export bans on domestic medical supplies and competing against other countries for coronavirus vaccine patents. In late June, The US government bought up nearly all the next 3-month projected production of remdesivir, a COVID-19 treatment drug, from US manufacturer Gilead. Even worse, the Trump administration has decided to officially withdraw from the World Health Organization in July 2021, which is bound to jeopardize global fight against COVID-19. Lawrence O. Gostin, director of the O'Neill Institute for National and Global Health Law at Georgetown University and also director of the WHO Collaborating Center on National and Global Health Law, has described the move as foolish, arrogant, and disastrous.